Now it is my privilege to invite Dr. Upneet Lalli, who is heading the Institute of Correctional Administration, Chandigarh. She is a trained psychologist, and none other but she can deal the issue of mental health of prisoners in a better way. Dr. Lalli is a world-acclaimed expert on prisons and correctional matters. May I request now to her to discuss her theme of today, that is mental health issues of prisoners. Dr. Lalli, please.
Thank you so much, Dr. KP Singh. And I thank Shri Ramachandran. Of course, we've got together OPM. I will try and be a little bit brief. The issue that I'm going to talk about is something, of course, flowing from the initial conversations of both Dr. Ahmed as well as Mr. Sumesh Goel. And Mr. Goel is very right in terms of saying that the most challenging part, of course, for prisoners, of course, it's a very negative environment. And as Dr. Ahmed said, prisons are damaging. So there are health issues and particularly mental health issues that exist within the prison setup. There are constraints and again, I would say I'll just share a brief presentation. The problem becomes all the more in the sense that we do not have the experts. So that's something that is shared as such by people in the prison department. These are some of the standards when we talk in terms of what obligation. The state has an obligation to provide adequate treatment. It's the responsibility of the state to provide healthcare services which are similar or at same level as and the Mandela rules also specify in terms of prisons having the number of specialists and psychologists, and mental health persons who have mental health problems, they must be treated with humanity. So these are all the various rules that exist, and a recognition of these rules is essential. What is mental health? Now, when we talk of health, total health, we say it's total well-being, not just physical health, and not just an absence of disease. But mental health is also a state of well-being in which the people realize their own abilities and can cope with the normal stresses and work productively. So when Mr. Goel was mentioning about improved mental health, so where, yes, you help people to work productively. And I think the most important aspect for prison officers, the challenge that remains, is that how do you manage the time of inmates inside? How do you manage the 24 hours? The 24 घंटे अंदर हैं जेल में, how do you manage those? So that becomes a challenge. The philosophy of prisons as correctional homes started with Mahatma Gandhi, who said, hate the crime and not the criminal. And opening up, let prisons be, and when we're talking of prison reform, so let prisons not be just merely places of confinement. There should be places where you also provide hope and you provide a bit of healing. Why prisons are bad for mental health? It's the physical environment. Any overcrowded prison is going to add to the physical element, is going to add to the stress. A person who's locked up, who has nothing to look forward to in life, there's a loss of purpose. You're not going for work, you've lost your job, the identities get stripped. The whole process is dehumanizing, and prisoners are separated from their families. There is also an exposure to violence that happens, there is bullying that happens, and there is extortion that may happen. So there is that whole exposure to violence that happens. There is also lack of treatment facilities inside, and yes, people in some places, of course, they may be separated, and solitary confinement, though, is not allowed in our system, but we've had instances where mentally ill were also kept separate. The priority of prisons is low. The priority of health system is further low. Prisons are not a priority of the governments, and there is a low priority which is also accorded to the mental health care. You will not have, in most states, you will not have qualified mental health staff. You will not have psychiatrists. You will not even have psychologists associated with the prisons. Southern states do have psychologists, and Bangalore and all do have psychiatrists, but most of the North Indian states do have, I mean, there is absolutely a lack of qualified mental health staff that is there. And at the same time, you know, prison staff is supposed to identify and support people with mental illness. You're supposed to identify whether a person is high on suicide risk, is a drug addict. So therefore, and also care for them. And I've seen that, I mean, I recall one visit to Chhattisgarh prison where prisoners who were mentally ill, who had been brought back after treatment from the mental health hospital, they were singing bhajans. So we've evolved also our own ways of caring for inmates with mental health issues. The person who enters into prison system, the first phase we say is the shock and denial. They cannot accept that something has happened to them and there is a numbness. And the first 24 hours are very critical for people who enter the prison system, and prison officers will know that a number of suicides, and we've done a study on suicides, that take place within the first 24 hours of the first week of imprisonment. And this is very, very critical. That how, and therefore classification becomes very important, and risk need assessment is very, very critical, which has been spoken about by Dr. Ahmed earlier. So these are the different phases, and when do you end? When do you start a particular program? When does the individualized treatment take place? Every person may have different set of needs and different set of risks. So a person who is a drug addict will have a different need. A person who is depressed has a different need. And an inmate who is been also, I would say, I've seen instances where persons who have been wrongly booked will have a different kind of a shock and different coping mechanisms that may be available with them. So some of the mental health problems which are faced before imprisonment will also continue when the person is in prison. So a person who has a mood disorder will continue to have that mood disorder while in prison. Psychotic disorder will continue out there. Drug and substance abuse. Persons who have a number of theft cases where they may have their problem, maybe because they are drug users. And in the prison also, there will be substance withdrawal, and prison staff have that challenge of managing. How do you manage withdrawal symptoms? Not every prison will have a de-addiction center. So therefore, you know, you have all these mental health problems that get escalated and excavated in the prison environment. So there may be instances of self-harm, and I've seen this across different countries in the world. I've seen a woman inmate in a UK prison who had about 24 slashes on her wrist. That was the kind of self-harm that existed. So there will be sleep disorders that may exist, and stress-related disorders that may exist in the prison. And yes, we spoke about, Mr. Gold spoke about post-release and whose responsibility, but also, you know, the prisoner will be stressed about what will happen after release. Does the family accept? There may be anxiety that may be related to the release issue. There may be substance withdrawal complications, and I've seen a number of, we've seen a number of deaths that take place due to drug overdose after release from the prison also. And problems can worsen, and there may be relapse also after release if the continuity of treatment also does not exist. So the contributing factors I've mentioned already, and it has been mentioned, if there is no lack of meaning, if there are no meaningful programs, you're not able to provide काम हम कितने लोगों को दे देते हैं? Creative artwork, how many people are doing that? So if somebody is having 24 hours, is not doing anything, even a normal healthy person will become sick, mentally sick. So lack of meaningful activity is a very, very critical factor that contributes to mental illness. There is a lack of privacy, and everybody needs some space for themselves. So this also contributes to stress, it contributes to anxiety as well. And it can become a downward spiral, and people can, you know, have difficulty in recovering from this. Even persons who stay for a few months inside the prison, I've seen them after release also having a post-traumatic stress disorder. That is the trauma right from arrest to the time of release, you know, that trauma remains with them throughout. So how do you identify? And prison staff is sometimes supposed to identify mental health problems. And what are the mental health problems? There could be suicide and self-harm. Suicide can occur only, and again, though the Mental Health Act has decriminalized suicide, how we view it in our prison manuals and prison rules is a different question. There may be confused thinking and speech, sudden swings in mood, ekdam bahut khush and then suddenly very low, erratic behavior. Some people may not look after themselves. They may be very dirty and filthy, and there may be something that you feel that yes, this person needs help. There may be withdrawal also. Some individuals may get withdrawn. They'll sit quietly in a corner, not want to talk to someone. And many times you notice that there is, with women, I've seen a lot of crying, and with women inmates, there's a whole lot of emotional content that exists in terms of being not able to express their own needs as such. So they may be either coming out in terms of aggression, verbal aggression, or also in terms of a lot of crying that happens. And not being able to recognize and communicate the problems that they need. COVID does lead to a lot of mental health issues throughout society and also in the prison world. There was also for the staff both stress and anxiety during the COVID situation. And drugs, that two things that I'll emphasize on is some challenges related to the issue of drug use, drugs and substance abuse. This is particularly dampened. Of course, Punjab is a state where almost about 50% of the prison population does have drug issue problems, drug and substance abuse issues. Number of persons who are booked under the NDPS Act may also be drug users. So you will have drug users both outside and as well as inside the prison. And prisons is a risk environment for drug use. Sometimes you end up having persons who have not used drugs earlier may end up abusing drugs inside the prison. And there is a market and there is a parallel economy that runs for this. In terms of the mental health problems, we find that there were almost 9,000 inmates who were reported as mentally ill out of the 5.5 lakh inmates. And similar proportion of both under trials and convicts were mentally ill. And the Mental Health Care Act 2017, it specifies that yes, the rights of mentally ill persons and the treatment programs that need to be made available. So the de-addiction centers and if they are in prison, need to be run in accordance with the provisions of the Mental Health Care Act, and you need to have committees. We've also had instances of mentally ill persons being forgotten by the system. And Dr. KP Singh would recall the case of Machunglal, and you've had Jai Singh case, where persons who were mentally ill were actually forgotten and they spent much more inside the prison. And even though they were supposed to have been free or under the Mental Health Care Act, they should have been in the care outside the prison system. So these are some of the instances, that happen, and the mental health status and at the time of classification is very important. This has been put in the model prison manual that prisoners who require mental health care, they should be attended to by an authorized medical attendant. And even in the Shatrughan Chauhan case, you've had where the Supreme Court has held that insanity and mental illness, they were the supervening circumstances, and a number of prisoners who were to be sentenced to death, their sentence was commuted to life imprisonment. And in Haryana also, there were 2-3 inmates who got that benefit. So number of, because just the, waiting to die, you're waiting to die. And just waiting to die leads to a different death altogether. You may not be physically dead, but mentally you are totally destroyed. And drugs, I mentioned, they get into, it's a real challenge for the prison staff to identify inmates, how they get in drugs. And they are often responsible as well. And it is a huge challenge. So 3 strategies that are being followed in terms of demand reduction, supply, and harm reduction. So for harm reduction, you have the OAT clinics inside the prisons being set up. And this is something that you have in certain countries, also needle and syringe exchange programs in the prison setup. Again, This is to be under the supervision of medical staff and qualified mental health care staff. Women prisoners have their own issues of mental health. And I always feel that, yes, prisons are not made with men in mind. They're made with men in mind, not with women in mind. And we need to consider in alternatives, we need to consider for different set of alternatives for most of these women offenders who may be low risk. And just being separated from their child is definitely stressful. And they have definitely more challenges in reintegration. And there could be postpartum depression as well in case of after childbirth. So this is something that exists. Time is limited. I'm just going to very quickly mention about suicide prevalence in prison. These exist throughout the world in terms of the suicide rate in prison population is twice that of the general population. And having done study on suicides in Punjab prisons, these were some of the risk factors that were found. The static factors included substance abuse, violence, pre-trial issues, and prior suicide attempt. Now, none of these cases, the prior suicide attempt was known actually. And bad news, rejection of bail, death in the family, these are all the dynamic factors that occur. And incarceration related issues, and also fear of being sentenced to, you expect that, yes, tomorrow is your hearing and maybe you're going to be sentenced. So these have led to suicide. And persons who have, some of the risk factors that prison staff need to be cautious about is persons who've not got any mulaqat, who have a weak support system, who have a negative view of self or one's future, who are also shamed, POCSO cases, because of the nature of offenses or any other offense where they've killed their child, there may be that part that triggers off suicide, attempt history, and depression, hopelessness. So prisons should not be places of hopelessness. They should promote hope, whether it is through work programs, creative arts, or combination of different things that are needed. And for identification, we've done programs on suicide prevention. Training of prison staff on suicide prevention is absolutely essential, where you learn to identify and at least give a psychological first aid, if nothing else as such. So monitoring them, assessment, these are some of the practices that ideally should take place. And each prison, each state should have its own suicide prevention training program, and both at the state headquarters and at the prison, each individual prison level. Reporting and review is very, very essential. So what can staff do? Staff and inmates can both build up peer support and mentoring, identify even warder level staff, identify prisoners who are sensitive, who can be good communicators, to develop as listeners. So listening, looking, and feeling are all important. They'll be the first responders. Who are going to be the first responders on staff? Constructive use of time, engage and involve everybody. That's very important. A better prison environment, a green environment, an environment that is clean is something that is absolutely essential. Improved relationships between prison inmates, between prison and staff themselves. Those are very essential. And providing counseling, even online counseling, that is something that in case any of the prison officers who are participating in this want help, please get in touch with us, and we'll help you out in this. And a well-being group that could be performed. Punjab, I think, had that. I'm not sure whether they continued with this. So yes, even mental health of the staff is important. The work that is done by staff is difficult. It's a negative environment that exists, and always staff say that inmates have, the fixed period, whereas ours is a continuous period. So you are released only at the time of your retirement. So that, there is counseling that is needed for staff, good management and good working conditions, and also the possibility of advancement and promotion. That is important. So mental health of the staff is also important, and better health and well-being of all who are working in the system and even outside is important. So I'll stop this presentation of mine And this was, a quick look at some of the mental health issues in prisons, which are very much neglected. And we need to have some kind of a concern and, some action that needs to take place to actually establish mental health care units within the prison setup. So, of course, I will look forward to the questions that will happen later on. Thank you, Dr. KP Singh.
Thank you, Upneet, for flagging the issues of mental health for the prisoners as well as for the staff. And I must say that mental health of prisoners is the area which is the most neglected area in prison administration. And we need to work very seriously and vigorously to address these issues. So thank you very much once again.